Form-Fit Hydrogel Canalicular Plug by Oasis Medical. Instructions for use. The Oasis Medical Form-Fit Canalicular Plug is designed to be inserted through the punctal opening in order to block tear drainage through the canaliculus. Upon contact with the fluids, the plug will slowly swell to approximately 3 times its initial size. It will form a soft, gelatinous material. Each Form-Fit Canalicular Plug is supplied sterile, in dry form, and preloaded in a disposable inserter. Indications for use. The Oasis Medical Form-Fit Canalicular Plug is intended to use in patients experiencing dry eye symptoms, such as redness, burning, reflex tearing, itching, or foreign body sensations. The Form-Fit Canalicular Plug may be used in the treatment of dry eye syndrome and the dry eye components of various ocular surface diseases. When indicated, the Form-Fit Canalicular Plug may be used after ocular surgery to prevent complications due to dry eye and to enhance the retention of topical ocular medications on the eye. Patients experiencing dry eye-related contact lens problems may also be aided by the Form-Fit Canalicular Plug. Insertion. Anesthetize the area of the punctum with either a topical anesthetic instilled into the conjunctival sac or an anesthetic-soaked cotton-tipped applicator held against the punctum for 30 seconds. The Oasis Medical Form-Fit Canalicular Plug comes preloaded in a disposable inserter. Verify that the white Form-Fit plug has not fallen out of the inserter during shipping. Place the brown tip portion of the inserter through the puncta and squeeze the inserter to push the plug from the inserter tip into the canaliculus. The top edge of the plug should lie below the punctum opening. Forceps may be used to further push the Form-Fit Canalicular Plug to obtain the desired placement. Removal. Should it be necessary to remove the Form-Fit Canalicular Plug, flush the gelatinous material from the canaliculus using a syringe filled with saline. Place an injection cannula on the tip of the syringe. Position the tip of the injection cannula through the puncta and gently flush the canaliculus with saline. Oasis Medical, where your eyes matter.